Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer sourced and solution focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Stefanie Beavers, who is the Chief Nursing Executive at OU Health, about why it's important for CNOs to manage their change management processes. So, hi, Stephanie, how are you?
I'm great. How are you, G?
I'm doing well. Thanks for being here and taking the time. So let's jump right in. As you know, and as our audience probably knows watching, restructuring at health systems or mergers or any sort of company reorganization can have a major impact on the workforce and cause a lot of confusion. So, what are some of those impacts of a health system merger or restructuring on the nursing workforce specifically?
Yeah, absolutely. I'll talk a little bit about our journey specific at OU Health and really how that evolution has driven where we are today for our nursing teams and services in the organization. So, we are an academic health system, and in 2018, we actually came out from under a corporate health system model where the organization was managed from out of state. And one of the big pushes for this move was really to bring the focus of the academic health system really into the state of Oklahoma and
Mhm.
how we drive and how we really give back to the community and what that looks like to be dedicated to the state. The other piece of that is really leaning into the identity of academic health
Mhm.
and what is the meaning and identity of an academic health system. So that journey started in 2018. Over that time, what we saw is in 2021, there was an integration of workforce from the academic element and the health system side. And we saw that
Mhm.
evolution occur over 2021 and then into 2022, which you might notice the lineup of this time frame was just right for a pandemic. And so much change was happening within this health system, and there was really a need to solidify the identity. So, a lot
Mhm.
of change happening rapidly. We had a lot of change in executive leadership across the organization, and we went on a cultural transformation and a cultural journey. So, I joined the organization in July of 2022
Mhm.
as the chief nurse for our children's hospital, and then actually stepped into the chief nurse executive role in the spring of 2023.
Mhm.
Very quickly, what I learned is when organizations go through this large scale systemic change and really making sure that how do you align your identity. So it was really
Mhm.
important that I took some time to pause and reflect and understand where have our teams been in this journey, what has been their experience,
Mhm.
and then what is the identity and true north of the organization as we move forward? And how do I intersect that in the most purposeful manner for our nursing frontline care delivery teams?
Mhm.
So, some pieces that I identified quickly as the organization was going through a full transformation of our culture was we were developing and identifying what is our mission and vision,
Mhm.
who are we in our identity as a health system, and leaning into being academic in nature. What does that mean to be an academic flagship for the state? Because we're the only full scale academic health system in the state of Oklahoma. And you really have to lean into being a beacon of hope, that anchor for elevating healthcare delivery in the state. But then how do you lean into that with nursing even more? Because
Mhm.
what can happen in large scale organizational changes is a loss of identity, a
Mhm.
lack of understanding how you lean in your purpose. There's also typically a lot of changes with, okay, what are my policies now? What are the
Mhm.
expectations of me at the bedside? And we often lose sight of that. And you've got to make sure that there is a strong connection to purpose for our frontline care delivery teams. Because one thing that does not change when you go through reorganizations, acquisitions, and mergers is there are still patients to take care of that are in need of our services. And at the end of the day, the most important thing that we do is the care of human beings in a vulnerable time. And how do we protect them with high quality care and keep them safe during those times of change? So I
Mhm.
think that's one of the greatest impacts that you really have to take into consideration and understand how do I lean in and lead through this?
Mhm.
Making sure that you're respectful of where the organization has been, but what's our identity and how do I elevate that through the nursing workforce and our care delivery across a system? No daunting task by any means, right?
No, it's super easy. Yeah, so you mentioned it. Obviously, patients get caught up in the middle when there's a merger acquisition, and I feel like in industries that are not healthcare, that variable doesn't exist. So it's typically it's not without bumps, but there's not that extra variable there. So how can CNOs prioritize patient care during major organizational change as well as their staff?
I think for chief nurse executives and sitting within the space of leadership for nursing, you really do have to lead through relational change. You
Mhm,
have to understand how do we communicate and translate to our frontline teams that the patient has to be at the center of everything that we do. No
mhm,
matter your industry, I will say everything boils down to people and process.
mhm,
So, how do we wrap around our people and our workforce to make sure that they have the processes that they need to deliver that high quality of care? But the most important thing that we can do is also make sure that we're building strong relationships with our patients, with the families, and really for the community. How do we maintain access to care? How do
mhm,
we lean into capacity? How do we make it seamless for the patients? One of the things that we did through our organizational changes, we developed our inaugural professional practice model, which
mhm,
really becomes your true north in laying the expectations.
mhm,
That becomes how, as a bedside nurse, am I delivering care to a patient that is within the identity of the organization?
mhm,
The other piece I would say is for nursing leaders and nurse executives is understanding your data during times of transition. What has changed between the prior organization and who you are today or how you're moving? What are your data points? What are your metrics to tell you that you're not off balance, that you're
mhm,
making sure that that patient safety is at the core of what you do? And so you've got to go back to the basics sometimes of looking at your core quality measures. We use Vizient as our true north for measuring and benchmarking our quality performance. And so
mhm,
making sure how do we lean into that, but then how do we translate that to nursing? So
mhm,
it's an intersect of that professional practice and professional identity for nursing, but also making sure you're driving through data and metrics that are measuring your performance with the patients. And at the end of the day, we talk a lot about patient experience within healthcare.
mhm,
Why that's so important is they are human beings that are
mhm,
vulnerable, that need our care, that have to be able to trust us. And when it comes down to their experience, what that really relates to for us is that's how they perceive the quality of care. So you've got
mhm,
to make sure that you don't lose sight of those components and that you're constantly weaving that thread through your messaging. I also think presence is critical when you're going through immense amounts of change. How
mhm,
are we present for the workforce? How is the voice heard of what they're experiencing and making sure that you're very sensitive to that in the operations and that you're sending very clear messages, what they
mhm,
can expect from us, who we are as an organization, and how do we wrap around them when their work is hard and they're
mhm.
going through change. And I think that's really important that we can't lose sight of.
Absolutely, yeah. And what are your tips for CNOs who are trying to kind of streamline that change management process? Because obviously there's a ton of moving parts and there's confusion and people are like, well, who's my boss now? Who do I listen to? What am I supposed to be doing? How would you recommend managing that?
I think very crisp communication is key and
Mhm,
frequent communication. The other piece is I am very fortunate to be a part of a very strong executive leadership team of
mhm,
remarkable human beings with experience from all over the country, all different backgrounds. And it takes that element and being a part of a strong team and how we manage each other up, how we recognize how every different division is sitting within the organization. Because as much as nursing is present at the bedside, it takes the entire organization and all disciplines to wrap around them so
mhm,
that they can be impactful and that they can produce results and perform at the bedside and really deliver that human centered care that's critical. I'm
Mhm.
also very fortunate that I have an amazing dyad partner in our chief medical officer, Dr. Clock, here at OU Health. And I think it's important that our workforce and our team see us as truly a unified leadership team
Mhm.
so that we're leaning in and leading together. And we're wrapping around them, we're recognizing what's a challenge. It's like you said, I've had, whether it's changes in leadership or we've had changes in policy, and now I don't know what to do.
Mhm.
Really do have to take it and scale back. We developed, under the leadership of our chief medical officer and our chief human resources officer, a transformation council. And we started
Mhm.
to line out what are all the different work streams that are coming at our leaders and that are coming at our frontline teams so that we as an executive team can understand everyone's priorities.
Mhm.
These are priorities, but the intersect is at the bedside and leadership, that they're getting a ton of information pushed at them. So, how do we make it meaningful? So, we started to really stage that purposefully and with strategy. The other thing that is key is you can have strategy all day long, but you have to be able to articulate it and
Mhm.
communicate it clearly to your teams and make sure that they know the end goal, but what is the process we're going to use to get there and how are we going to support them through it? But being clear, being crisp, being organized and polished in your approach really does change and make it seamless for the frontline teams and what they experience through that change.
Mhm. Absolutely. Yeah. As a writer, I could not agree more. Communication is key always. So you touched on it a little bit earlier, but tell me a little bit more about the nursing professional practice model. What are kind of the core ideas behind that?
So, as we went through a cultural transformation in our organization, one of the things that I learned very quickly as I walked through what are the resources for our teams? How do we organize within the nursing workforce from the lens of nursing excellence? And
Mhm.
what's the definition of nursing excellence? I found that we had not established a professional practice model, which we know is truly that evidence based practice that
Mhm.
aligns the organizational values with a framework driven by research and outcomes to really elevate to nursing excellence, but more importantly, to patient outcomes and the identity of our teams. So
Mhm.
we selected the Joanne Duffy quality caring model so that we could take those caring behaviors and we integrated them and wove them through our organizational values. Something that was
Mhm.
really important to me as we led this initiative is I wanted to make sure that we did not confuse the workforce. We didn't
Mhm.
confuse our nursing teams and create this whole different grouping or parallel model that was outside of our organizational values. We had just streamlined and like truly established our mission and vision, and
Mhm.
through those core values, it was important to me that our nurses could find their identity. And we took those caring behaviors from the Dr. Duffy model and we wove them in. So,
Mhm.
our values as an organization are patients first. They're at the core and center of everything that we do. The
Mhm.
dedication to relentless excellence, integrity, practicing in a space of inclusion,
Mhm.
teamwork, and then through learning. And especially as an academic health system, that is critical. But we took the professional practice model as our guiding light and really, what is our identity as nursing within the organization? What is the brand of OU Health Nursing and how do we show up? And then
Mhm.
how does that translate to our care delivery? So the other piece that I would say that's really important with your professional practice model is how do your frontline teams actually know it exists?
Mhm.
How do they know the expectations? How do they know this is the professional identity that we live into in the organization? So we actually took it to all of our clinical orientation, right? We did a huge rollout of it and really worked to highlight and elevate the professional practice of nursing. What
Mhm.
does nursing excellence look like? A lot of questions always come up around magnet designation. And what I tend to tell people is the magnet designation is one aspect. Nursing
Mhm.
excellence is a continual journey. So
Absolutely.
we've really worked truly to line out our layers of nursing leadership. how we orient, how we work, and make sure that the professional practice model is at the core of how we do the work as nurses.
Mhm.
We also took recently and intertwined our professional practice model with the AONL core competencies of leaders. And
Mhm.
so we take it and translate for the bedside nurse with our values and those caring behaviors, but then we take it and we actually elevate even more for our leaders and say, okay, what are the core competencies of leaders in the organization?
Mhm.
What are our industry standards through AONL? And then how does that actually look in practice day to day as you're leading your teams for our professional practice model here at OU Health?
Mhm. Absolutely. I really like the part that you mentioned about making sure that your nurses know that it exists, because I was speaking with a few CNOs on a panel recently about recruitment and retention and all of that, and we were talking about the same thing. You know, you can strategize and create programs all you want, but unless people know about them and use them, it's
Yep.
not going to do anything.
Yes.
Yeah. So, have you seen any positive outcomes since implementing this practice model, whether it be from the nurses or other administration?
We have. I will say the organization has been in this continual state of evolution. And with our nursing services in particular,
Hmm.
over the past year, by an intersect, if you will, of that professional practice model, really elevating and defining our standards and
Hmm.
processes. So, how do we actually do process improvement? What does high reliability look like in our space? So, it's all of the tools really coming together
Hmm.
to define your culture, and it has to be one of engagement. I always say if your nurses are not engaged, it's really hard to propel a healthcare organization forward.
Hmm.
They become the backbone because they are that constant at the bedside, right? Every discipline has to wrap around them, but what does that look like?
Hmm.
So we've seen pretty significant improvements across all of our quality performance. So CLABSI, CAUTI, we've had a huge initiative around fall reduction and focus in that space. And again,
Hmm.
going back to my partnership with our chief medical officer, that's where we're able to set the tone of this is what great looks like, right?
Hmm.
We have
Hmm.
had massive improvements from that stabilization piece of those quality outcomes and data driven metrics. We've also had huge workforce initiatives.
Hmm.
We are very fortunate to have partnership with the University of Oklahoma College of Nursing. Dean Kraft and I have been able to sit in this space where we're really elevating how do we partner to develop the workforce. And in an academic center, sometimes you can't be selfish. You have to look at not just your own organization, but how are we producing high quality nurses for the entirety of the state.
Hmm.
And so this professional practice model has been an opportunity to really dive in and help as students come in even to identify how am I going to transition to practice?
Hmm.
What does that look like to be successful as a nurse? And what does it look like to be a professional nurse?
Hmm.
So we've launched significant efforts. We call it our career launch day. So we have an employed student model in the organization that we are able to leverage as our clinical rotation. As those students come in, they can work as employed students and they can do, say, a nurse tech role. We're going through as they onboard in the education, setting the stage for professional practice, but we're also working in what's your identity and where do you want to live as a nurse? And then we're matching them to those spaces so that they can actually transition to practice through their clinical experiences, their nurse tech roles, focusing those shifts in the area that they think that they want to work in as a nurse. So then they're acclimating. They're seeing professional practice in real time in the area that is their hope and dream to spend their career. And so it's really been this anchor for us from an identity perspective. We also have huge initiatives. We invest $1 million every year in partnership with the College of Nursing to really develop our nursing teams from anything from an RN to BSN all the way through a PhD that we cover at no cost to the employee so that then we're elevating that practice. We set the stage with our professional practice model. Now, here we paint what does your career journey look like? And it allows us to elevate the core of the organization through academic practice, but also helps people to see, as we've been through all of these changes in the organization in the past, we are a stable organization. This is
Mhm.
what we're dedicated to. This is who we are as an academic flagship. And so it further solidifies that identity, if you will.
Absolutely. Well, it seems like it's been a very successful strategy at OU Health. So, do you have any advice for CNOs who might be looking to use a similar strategy?
I think most importantly is listen to your teams.
Hmm.
Understand their experiences and understand what translates and what resonates to them. One of the most important things you'll do with your professional practice model is to drive your identity, and you
Hmm.
have to make sure that it truly connects to purpose. We, sitting in the seats as nurse executives, have to make sure that we are working through the purpose and through the lens of winning the hearts and minds of our teams.
Hmm.
We are nurses at the end of the day, dedicated to the well being of our patients, dedicated to the well being of our community, and that has to translate to how we work.
Hmm.
I think sometimes us being vulnerable and leaning in and showing who we are as nurses is incredibly powerful.
Hmm.
Leveraging our experience, but also listening to what the teams are working through and what impacts them so that we're making sure that this really lands with what they need for their own professional identity. Because if the two don't correlate and they don't align, we'll miss the
Hmm.
mark and it won't be
Hmm.
meaningful to them and it won't connect to their purpose. So I think you always have to know what is your own anchor as a leader and
Hmm.
how does that really align with your organizational identity? What is the purpose and what is the mission and vision of your organization? I am very dedicated and driven by being an academic flagship and what that means for the state because it truly sets the stage.
Hmm.
It elevates the level of care we're able to provide. And I know that through the work of nursing and how we build the workforce for the state of Oklahoma, we have a huge impact, not only to the outcomes of our organizations, but really what the footprint is for nursing across the state of Oklahoma. And so I
Hmm.
think you have to lean into your own identity as a nurse, leveraging those experiences, drive through compassion, drive through empathy, wrapping around what your teams are experiencing every day, recognizing what's hard, but recognizing what resonates with them and what speaks to them. And then really intertwining that with your professional practice model, but also all of the other initiatives that are going to be downstream from that.
Hmm.
What do they need as a workforce? Whether you use your engagement survey results, whether it's through grassroots rounding, but making sure that voice that you're also doing something with it and making sure that you're driving through what they find purposeful so that you're able to intersect and help them find their place. People leave their homes and their families to come and
Hmm.
take care of others in our organizations. We want to make sure it's the best environment possible and that they are able to find meaning and recognize that they do the most noble work there is in taking care of other human beings.
Absolutely. Well, that is a beautiful note to end on. So, thank you so much, Stephanie, for your time. I'm really grateful to have had this opportunity to get to know you a little bit better and hear your insights. And thank you so much to our audience for listening. Thank
Yes,
you.
thank you so much, Gia. It was wonderful to be here today.
Of course. Thank you.